Hi, Dr. Pelto here. I have this question today I want to talk about is when a full toenail permanent matrixectomy was done to me, it unfortunately scarred the nail bed and it looks so weird now. Also, there's some nail along the sides. What should I do? Let's talk about what is a matrixectomy. So an ectomy is where you remove something, and the matrix is a portion of the nail right here at the base of the nail underneath the skin. This is where what we call the matrix, or where the germination, where the nail starts from. A portion of the nail starts at the base of the nail, and another portion actually starts on what we call the nail bed. Therefore, when you're doing a permanent matrixectomy, this means you're permanently killing the nail. You hopefully don't have any nail that grows back. Unfortunately, that's not always the case. In this example here on the left, you can see a little piece of nail in the edge. This is quite common because when you do a matrixectomy, you put medication on the whole nail base, and sometimes a little portion of cell doesn't get the chemical that you put in there. The two most common chemicals are phenol and sodium hydroxide. In our office, we use sodium hydroxide, and you apply this chemical between 30 seconds to 1 minute, and then you put something else on top of it to neutralize it, and that causes a chemical burn. But as you can see, this little nail has something on the side. This one here has a little bit of nail that grows up to the top, and this one here has kind of a weird looking nail in the center that had a matrixectomy. Something else you're going to notice is the tip of the big toe right here, and right here. It looks very what we call bulbous. It almost looks like there's a bulb on top. The reason for that is because as the nail grows out, it usually pushes down the tip of the toenail. In this specific case, there's no toenail to push it down, and that can make it look a little bit funny. Now, the question is, now that it looks weird, what can you do? If there is no nail, you can't do anything at all. You're stuck with it. You can try painting the skin. You can try gluing on a fake nail. If there is some nail on this, you can do a procedure called Cariflex. Cariflex is where you put on a fake nail on the top, but you can only do it if you have a little bit of nail there to attach to. I'm going to include some other videos here about Cariflex, where you can learn about it. Some of the other treatments for ingrown toenails, Cariflex is one of the other options for it. And you can learn more with some of these others videos. Once again, if you like this, please subscribe to this channel. And if you want to learn more about ingrown toenails, I do also have a video that talks about bulbous treatment, how to treat this bulbous change at the tip of the nail. This is a problem because as the nail grows out, it gets ingrown, and it can cause an ingrown toenail at the tip. I'm going to include that video here on the side as well.